Hi everyone, my name is Sarah Vernon, and I am a staff member here at the Tallahassee Senior Center. And today I'll be giving a presentation entitled Protecting Your Head, Epilepsy, Seizures, and Safety. And so November is National Epilepsy Awareness Month. And so the purpose of this presentation is really just to inform everyone about epilepsy and specifically within the older adult population, and also talk about a little uh, protecting your head and head injuries and how that relates to seizures and epilepsy. So here's just a general overview of what I'll be discussing in the presentation. I'll start off by kind of defining what epilepsy is, then the types of seizures, how those present themselves, epilepsy in seniors specifically, how to handle convulsions in older adults, some of the causes, um, head injuries and protecting your head, and how that relates to epilepsy. And then we'll go into the prevention, diagnosis, and treatment. And then I'll share some resources that hopefully will be helpful to you all. So first off, what is epilepsy? At its basis, it's a brain disorder that causes repeated seizures. And it's important to note the repeated seizures part of this definition because just because an individual has a seizure doesn't necessarily mean that they have epilepsy. Individuals with epilepsy typically have seizures that occur in some sort of pattern. Maybe they're brought on by the same trigger or source. And so it's just important to remember that one seizure isn't necessarily indicative of epilepsy. And then seizures are just electrical disturbances in the brain. And so the type of seizure you have depends on the location of the disturbance. And so seizures are classified into two main groups, focal and generalized. So the generalized versus the focal seizures, what does that look like? Generalized seizures affect both sides of the brain, and they can present themselves as absent seizures, which is just rapid blinking or staring into space, or a tonic-clonic seizure, which is the type of seizure that we all probably typically think about, the type that's depicted in movies or television, where the individual may cry out, lose consciousness, fall to the ground, or have muscle spasms. But then you have the focal seizures, which are just located in one area of the brain. And so the simple focal is characterized just by twitching or a change in sensation. You can have a complex focal, which means the individual may seem dazed or confused. They may be unresponsive for a few seconds or minutes. And then a secondary generalized, where it starts as a focal seizure and then spreads throughout the brain to become generalized. And so, as you can see, these focal seizures are much more subtle than the generalized seizures. And these are the type of seizures, especially in older adults, that may be overlooked. You may not even realize that the individual is having a seizure because the symptoms are so subtle. Or you may think they're having some sort of other, maybe some memory problems. So here's just a little graphic of the different types of seizures. As you can see, the focal seizures are just located in this one small area of the brain, where the generalized seizures are located on both sides of the brain. So next we have epilepsy in seniors. What does that look specifically for the older adult population? So nearly 1 million adults over 55 have epilepsy. And many of these individuals have had epilepsy for many years, maybe their entire life, but a good number of them actually develop it later in life. And so focal seizures are actually the most common type of seizures in seniors with epilepsy. And these are the seizures that are located just to that one area of the brain and are much more subtle and are characterized by symptoms such as confusion, memory loss, or loss of language. Unfortunately, the most common symptom of seizures in seniors is dizziness, which is actually a common symptom in many other diseases, which can lead to seizures being overlooked or mistakenly diagnosed as other conditions, including TIA, which is mini strokes, many memory problems, fainting spells, migraines, tremors, or panic attacks. But the good news is, if the individual doesn't have any other physical or mental conditions, seniors can continue to live independently. Epilepsy is by no means a debilitating condition. It can definitely be controlled and maintained so that independence can remain. So, handling convulsions in older adults. What would you do if you encounter an older adult having a seizure? So, first, you want to try and ease the person into a reclining position on the floor or flat surface. Um, Find an open space and lay them down. That just is a safe area for them. If the individual is seated or up against something, they can fall. And so, if you're able to safely ease them into a reclining position, that would be great. You will also try to put something soft and flat under the head. That just prevents them from harming themselves or causing any head injuries. Next, you want to turn them gently to one side to prevent choking. So, if an individual is having a seizure, they may produce some liquid in the mouth. And so, if you turn them gently, any liquid that's produced will be able to drain out of the mouth and they won't be able to choke on it. And similarly, if you weren't able to get that individual into a reclining position and they are still seated, simply turning their head will allow the fluid to drain away from the mouth. Next is an important one. You don't want to force anything into the mouth. A lot of people have the idea that when someone's having a seizure, they may bite their tongue or their lip. So they think that putting something soft in their mouth will prevent them from hurting themselves. But in reality, it's more of a choking hazard than anything. So you really don't want to put anything in the mouth. Um, it typically does more harm than good. And then, of course, you don't want to give fluids or medication until the seizure is completely over and the person is fully alert. And then don't try to restrain the jerking movements of someone having convulsions. That once again just does more harm than it does good. You may want to make sure there are no items or anything that the individual could run into or hit that could harm them, but you don't want to physically restrain the individual. So here's just a little graphic that can help you remember what to do in case you encounter someone having a seizure. And it's the 3 C's. So stay calm, cushion their head, and call for help. And so, what are the causes of epilepsy in older adults? Unfortunately, many of the risk factors of epilepsy are more common and more likely to occur in individuals who are older. So, that could be strokes, head injuries due to falls, or diseases that affect the brain functioning, such as Alzheimer's or brain tumors. The most common cause of seizure in later life is cerebrovascular, which means changes or damage to the blood vessels surrounding the brain. And that usually occurs during strokes. But you can also have drug side effects that can contribute to seizures. Many older adults are on prescription medication, sometimes more than one. And sometimes these medications have side effects or don't interact well with one each other and may cause seizures. So it's important just to be aware of that and be aware of the medication that you're taking. And if you are an individual who has epilepsy, some of those triggers that may bring on seizures include drinking, skipping meals, poor sleep, stress, or anxiety. And so it's important to maintain a healthy lifestyle when you have epilepsy. And if you're able to pinpoint some of those triggers that bring about your seizures and avoid those, that would be really beneficial to your health. So now we're going to go into head injuries and how that relates to seizures and epilepsy. So approximately 1/3 of adults over 60 will fall at least once a year, um, many resulting in head injuries. And many of these adults will fall multiple times a year, maybe hitting their head multiple times. And so 20% of seniors with epilepsy are due to head injury and traumatic brain injury. And TBI is uh, something that individuals can take steps to prevent a lot of times. A lot of the incidents in which TBI occurs, preventative actions could be taken to lessen the risk of that occurring. So I'm going to go into more of that in the next couple slides, what kind of actions and steps that you can take to maintain your safety and protect your head. And then additionally, certain anti-seizure medications have an impact on balance and walking. And so this is kind of the other side of if you're an older adult with epilepsy and you're on anti-seizure medication, just be aware that sometimes this medication can impact your balance or your ability to walk and make you more susceptible to maybe falling or hitting your head. So now we have protecting your head. What can you do to protect yourself and take some preventative actions to head injuries? And so I've kind of grouped these into two categories. First being falls prevention. How can you prevent your falls? And it has to do with being aware of your medications, of trip hazards, exercise, nutrition. And then the second one is what I call activity safety, where you're living this active lifestyle. What can you do to make sure you do so in such a safe way? So I'm going to go into that a little bit more in the next couple slides. So falls prevention. What are the causes of falls in older adults? Poor eyesight and hearing. So this can lead to you not being aware of your surroundings, not being aware of any trip hazards that may be around you. As I've said before, medication, the side effects of medication may impact your balance. Multiple medications may interact with each other. Maybe you get dizzy. Then you have weakness and poor balance. And this could just be due to aging or some other conditions, but that balance and weakness can lead to you being at a higher risk of falling and hurting yourself. And then we have environmental hazards. And these are things, events, situations in the environment that increase your likelihood for falling. So for example, if it's cold outside and your front porch ices over and you go outside and you slip on that ice, that would be a fall due to an environmental hazard. Versus a behavioral hazard where you are doing some sort of action or behavior that will put you more at risk of falling. So, for example, if you're an individual who knows that they have poor balance, but there's a light bulb that needs to be changed, so you stand on a chair to try and change the light bulb and you end up falling, that would be a fall due to a behavioral hazard. And then we have the personal prevention, the kind of steps that you can do as an individual to prevent falling and maintain your safety. And so first and foremost is stay active. This just leads to a healthy lifestyle. It could be just going for a walk every day. It could be participating in fitness classes. The senior center has great fitness classes that really work on maintaining or improving strength and balance of the individuals. And so just taking some actions to make sure that you are staying healthy. And then have your vision checked regularly. Make sure if you have a prescription, it's the right type. If you need glasses, get them. Also have your medication reviewed regularly. As I've said a couple times before, medication can have side effects. And so making sure that there are no negative consequences to your medication or how they interact with one another is important. Next, you could wear non-skid shoes inside. This just provides an extra layer of stability so you don't slip and fall. One option, you could have a home safety assessment. This is where a professional will come out to your house and kind of assess your home and see if they can identify any trip hazards and kind of give you some options of how you can address this and make your house more safe. A lot of fire departments do this sort of thing for older adults. And then you also want to be mindful of pets. Just know where they are. They can be a trip hazard, especially little small ones. You may not see them in the corner of your eye and you may trip over them. But then there are also some home modifications that you can do to kind of make your home safer. For example, you can clear the pathways. Make sure that your hallways and your walking paths in your home aren't cluttered. You can install adequate lighting just so that you can see well and see any hazards that may be around you. And then you can secure or remove throw rugs. Um, Throw rugs are easy to slip under and trip, so securing them with one of those rubber back secured or stickers is great. And so a couple months ago, I did an in-home safety presentation where I went over safety in the home and specifically some fall prevention um, actions and some home modifications that you can do to keep your home safe. So it's really this information, but a little more in depth, and also covers some other topics such as fire safety and scam safety. And so if you want some more information on fall prevention or any of those other topics, you can review the in-home safety presentation, and that's also available on the Senior Center Facebook page. So next we have activity safety. So what can you do while you're living this active lifestyle to make sure you stay safe? So of course you want to wear helmets when playing sports, riding bikes, horses, motorcycles, or all-terrain vehicles. Additionally, you want to wear seatbelts in the car. These are just some common sense steps to take so um, that if you are in a car accident or you fall off your bike, any of those incidents that can occur, that your head is protected uh, and you won't get seriously injured. And then also, you want to be careful on ladders and stairs. Make sure you have some sort of support around you if you have poor balance or strength. And then some things to consider while exercising. As I said before, exercising and staying active is really important in being healthy and preventing falls, but you want to make sure you do it in a safe way. So first, be aware of your surroundings. Know if there's anything around you that you could run into or trip over. Um, you want to warm up properly, maybe do some stretching, drink some water, and then don't overdo it. You don't want to injure yourself while exercising. Make sure you're exercising at a pace that is safe and comfortable for you. So next we have the diagnosis process. And so diagnosis may be tricky because some of the symptoms of epilepsy are also symptoms in diseases common in older adults. Like I mentioned before, that dizziness, that memory loss, language loss, those are symptoms that often occur in other conditions that affect older adults. So there may be some misdiagnosis, or it may take some time for the doctor to finally come up with the correct diagnosis of epilepsy. And so while they're going through this diagnosis process, they'll probably conduct a medical history and a physical examination. They'll probably assess the type of medications you're on and see if that could be a cause of the seizures. And they'll search for medical conditions that would lead to seizures, probably do a blood test. They may do an MRI, an EEG, or a CT scan. And then when the doctor is asking about your seizures, there are some questions that will probably come up, such as how were you feeling beforehand? Were you tired? Had you eaten or drunk anything? What happened during the seizure itself? Did you have any unusual movements? How long did the seizure last? How did you feel afterwards? Were you confused, tired? Did you need to sleep, or did you have a headache? Um, and so maybe thinking about your seizure and coming up with some of these answers before you go to the doctor would be helpful, so that they can kind of get a context, an idea of what happened, and this will help them pinpoint maybe a trigger or what type of seizure you had. And if you don't remember your seizure, if there was an individual who was present during it, maybe discuss with them kind of what happened so that you can really get the doctor a clear picture. So next we have treatment. And so although epilepsy can't be cured, it can be controlled with medication, diet, devices, and surgery. So if an underlying cause is known, there may be ways to treat it directly with surgery or medication. So for example, if the doctors find that a brain tumor is the root of your seizures, they may be able to go in and directly treat that brain tumor, which will alleviate um, your seizures. But if direct treatment isn't possible, doctors will usually prescribe one or two medications to help control seizures. But as I've said before, a lot of older adults are already on prescription medications or may have other disorders. 8 out of 10 adults 65 and older have more than one chronic disorder. And so it may be difficult to balance the epilepsy treatment with medications. And so this is just kind of a conversation you need to have with your doctor, and just so that you're aware that it may be difficult to find this balance and it may take some time. And additionally, anti-seizure drugs may influence bone health and have an impact on balance and walking. And so that's just another thing that you should be aware of. So diet is an option to help alleviate the symptoms of epilepsy. So a high-fat, very low-carb ketogenic diet is sometimes used to treat medication-resistant forms of epilepsy. Over 50% of individuals who adhere to this diet report greater than 50% improvement in seizure control and 10% experience seizure freedom. So it definitely improves um, the symptoms of epilepsy for the individuals who adhere to this diet. But because it's such a strict diet and it is so different from how a lot of people eat, it's really important to talk to your doctor before beginning this diet, because it's definitely not for everyone. People who may have underlying conditions, this could exacerbate them. Um, and so it's important to make sure that this is a diet that would be healthy for you. So don't start it without talking or discussing with your doctor beforehand. So next is mental health and kind of how that relates to those with epilepsy. Those with epilepsy tend to have a greater rate of mental illness. 20 to 30% of patients with epilepsy experience symptoms of depression, and they have a 40 to 50% higher suicide rate. And a lot of these mental health issues kind of stem from the stigma of the disease and the associated psychosocial consequences, such as low self esteem, social withdrawal, and isolation. Um, so, individuals with epilepsy may feel embarrassed about it. They may fear going out in public and having a seizure and not being able to get to a safe area or get help. So of course, this will cause them to withdraw and isolate. Um, but there are some really great resources for those who are struggling. You have 211 Big Bend, the Appalachia Center, and the National Suicide Prevention Lifeline. Then we have some local resources as well. These are resources here in the uh, Big Bend, Tallahassee community. So you have the Florida Department of Health brain and spinal cord injury program. And so these are for individuals who had one of those TBIs, traumatic brain injuries. And so they provide case management, inpatient, outpatient care, transitional living, and just overall support services for um, those with TBI and their families. And then you also have the Epilepsy Association of the Big Bend. And so they provide case management, so connecting those individuals with epilepsy to local resources, helping with their insurance and medication and any health related uh, incidents. And then also they provide community education. So really working to educate the community about epilepsy and hopefully get rid of some of the stigma surrounding the condition. And so here are the resources I just discussed, some links, and then the phone number to the National Suicide Hotline. So if you're interested in any of those, this is where you can access them. And so um, that's really the end of the presentation. That's all I really have for you guys today. But if you have any questions, please feel free to reach out. Um, This is our address, the Tallahassee Senior Center, 1400 North Monroe Street. This is the main number, the 850-891-4000. And these are our links to our two websites. So I hope this was informative and helpful to you all. And if you have any questions, please feel free to reach out.